When it comes to the eyes, injuries can cause permanent vision loss if not treated quickly. Prevention is always better than treatment. So use protective eyewear in any high-risk situation. Orbital trauma. Orbital trauma often happens alongside a head injury. Always take care of airway, breathing, and circulation before moving on to the eyes. Once the patient is stable, look for bruising, swelling, or bleeding under the skin. Check vision early so you have a baseline. Think about orbital fractures in any blunt injury and keep optic nerve damage on your radar. Major warning signs? A ruptured globe, tissue protruding, or bleeding inside the eye. All of these need immediate surgical evaluation. Soft tissue injuries. These can show up with tenderness, swelling, bruising, or forward displacement of the eye. That's called exophthalmos. For mild cases, clean the wound, suture if needed, start with cold compresses, then switch to warm later. If swelling increases orbital pressure, surgical drainage may be needed. Orbital fractures. Diagnosis is confirmed with X-ray or CT scan. A blowout fracture is when the orbital floor breaks, sometimes trapping the eye muscles and making the eye sink back. That's enophthalmos. Fractures of the orbital roof are higher risk because they're close to the brain. They may need both neurosurgery and ophthalmology. Most surgery is delayed 10 to 14 days until swelling goes down. Unless the eye has dropped into the sinus, then it's urgent. Foreign bodies in the orbit. Many are left in place unless they're toxic metals like copper or iron, or plant material that can cause infection. Never do an MRI if you suspect metal. Remove it only if it's toxic, causing damage, infection risk, or easy to reach. And give antibiotics to prevent infection. Ocular trauma. Eye injuries are a leading cause of blindness in children and young adults, especially in males. Common causes: work injuries, sports accidents, BB guns, motor vehicle crashes, and explosions. 2 emergencies where seconds count first: chemical burns. Start irrigation right away with tap water or saline. Second, penetrating injuries. Never remove an embedded object. Protect the eye with a shield or even a paper cup, no pressure. Assessment. Ask about baseline vision, past surgeries, and exactly how the injury happened. Check for sudden or gradual vision loss. In chemical burns, measure pH. Look for corneal defects, wounds, unequal pupils, and restricted eye movement. Management splash injuries. Irrigate immediately. If the globe is ruptured, skip eye drops until surgery. Give IV antibiotics, tetanus prophylaxis, and pain relief. Foreign bodies or corneal abrasions. Remove superficial debris, apply antibiotic ointment, and sometimes patch the eye. In contact lens wearers, treat for possible infection. Never send them home with topical anesthetics. They hide worsening damage. Blunt trauma can cause retinal detachment or tissue tears. Watch for hyphema, blood in the anterior chamber. Keep the patient quiet, shield the eye, and avoid aspirin or anticoagulants.